Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the Down syndrome. The Down syndrome is the most common chromosomal anomaly and it is an important cause of mental retardation. So, the Down syndrome is the most common chromosomal anomaly it is a common cause of mental retardation. We got the Down syndrome. So what is its incidence? Incidence of Down syndrome. Incidence means new cases in a population. Incidence increases as the maternal age is increasing. So it is 1:1400 the maternal age age 20 to 24, then the incidence would be 1:1400. The maternal age is 45, then it will be 1:15, 1:25. 1:25. So as the maternal age increases, there is more chances to get baby with Down syndrome. We got the incidence of Down syndrome. It is more common in the babies of elderly women. When the pregnancy happens in the later part of the reproductive year, more chances to get babies with Down syndrome. That is 1 in 25 live birth. But if there is pregnancy during the year 20 to 24, then it should be 1 in 1400 live births. So what is Down syndrome? It is a chromosomal disease. What is the problem? Most common problem is trisomy 21. Trisomy 21. So if we study the karyotype, this is the karyotype. This is the karyotype. Karyotype is the study of the chromosome. The chromosomal constitution of an individual is called karyotype. Then we'll get one extra set of chromosome in pair number 21. We'll get one more chromosome. Here, that is the trisomy 21. It is more common in the babies born from the older mothers. Trisomy 21. If 3 chromosomes are present instead of usual 2 chromosome here in the chromosome pair number 21, so we call it trisomy 21. What is the problem? There is some problem in the meiosis. Okay, so this is a meiotic non-disjunction. That is the problem. It is the meiotic non-disjunction of chromosome Okay, so resulting in gamete with 24 instead of 23 chromosome, resulting in gamete with 24 instead of 23 chromosomes. Okay, we got that. Subsequently, in a zygote with 47 chromosomes, and subsequently in a zygote with 47 chromosomes. Okay. Normally, a zygote should have 46 chromosomes, 23 chromosomes from the sperm, from the spermatozoa, and 23 chromosomes from the ovum. But here it will be 23 from the sperm and the 24 from the ovum. So you will get 47 chromosomes. So that is called trisomy 21. So this is the cause of Down syndrome in 95% cases. This is the cause of Down syndrome. This extra set of chromosomes will cause a lot of problem in the body. Okay, so we got trisomy 21. That is the cause of Down syndrome in 95% cases. So that is trisomy 21. We have other problems may happen that may lead to Down syndrome. One is the translocation of chromosome. Okay, of chromosome. We call it Robertsonian translocation. Chromosome. Okay, that is associated in 3% cases. Another problem may happen, we call it mosaics. Here, 2 or 3 sets of chromosomal constitution is found in the cells. Okay, so we may have mosaic. So some cells are normal, some cells with trisomy. There is a mosaic that may happen after zygote formation, okay, during mitosis, but it is mostly a problem of meiosis 1 or meiosis 2. That is the most important problem in oogenesis mostly. Okay, so this person may be a carrier for future Down syndrome in case of translocation of chromosome. Okay, so we got 3 types. Mosaic is found in 2% cases. We got the trisomy 21 translocation to chromosome number 14 or chromosome number 22. So that may happen. And trisomy is not only confined to 21. We have some other types of trisomy, like that of trisomy 13 in case of Petuas syndrome. Okay, so we have, this is Down syndrome, trisomy 21, Down syndrome. is a typical case of Down syndrome. So, but we have other trisomy. Trisomy 13. Trisomy 13 is called Petau syndrome. Okay. We have another one, that is trisomy 18. Trisomy 18, that is called Edwards syndrome. Edwards syndrome. Okay, so we'll discuss about the trisomy 21. So these other trisomy, we may have other trisomy in chromosome number 16 that may lead to spontaneous abortion. Spontaneous abortion is present in all type of trisomy, is possible, but in case of trisomy 16, more chance to get spontaneous abortion. Okay, we got that, the trisomy 21. Okay, so now we go to the clinical features of Down syndrome. How can we diagnose the Down syndrome? First of all, we must find out the clinical feature. Okay, so we'll go to the clinical features. Okay, this extra set of chromosome cause a lot of problem. If you look at the figures here, so if you look at the head of the newborn baby, okay, so we'll get microcephaly. Okay, so microcephaly, and in case of newborn, we'll get hypotonia. Okay, hypotonia we can diagnose in a newborn. Tension in the muscle is less. Not only in children, also in adult, there will be hypotonia. Okay, and the newborn will sleep too much. Sleepy newborn. Okay, more than usual sleep. Okay, sleepy newborn. Okay, we get thick nuchal skin. Thick nuchal skin. We get that. Okay, so we go to the head region. What are the problem in the head? Okay, we got this person has usually smaller head, microcephaly. That is possible, but we might have other problems. There will be low IQ. There is a very big problem, low IQ. So it is a cause of mental retardation, low IQ. Okay, here low IQ, and we also get early onset of dementia. Okay, that is the Alzheimer's disease. Alzheimer's disease, one of the cause of dementia is Alzheimer's disease. Okay, and this is early onset of Alzheimer's disease, maybe at the age of 40. Okay, so we got the dementia. So these are the problem in the head. If we go to the neck region, we have other problem in the neck. Neck we just discussed. There is excess nuchal skin in the neck. There is excess nuchal skin, just we discussed previously. Plus we get instability of the atlantoaxial joint between the first cervical vertebra and the second cervical vertebra. We may get other anomaly in the cervical vertebra. That is possible. Okay, all are due to one extra set of chromosome. Okay, anomaly in the cervical vertebra we may get, and certainly not only excess nuchal skin, we have short neck, and the child or the adult who has the Down syndrome, they have age-old obesity. Obviously it is common among them. Okay, we got the neck region. We'll go to the face. Before going to the face, in the head and the skull, we have to add one more point, that is called, there is flattening of the occipital bone. We call it brachycephaly. That is the flattening of the occipital bone. That is called brachycephaly. Okay, we'll go to the head and neck region. We'll continue on head and neck region. We'll get flattening of the face. Flattening of the face. Okay, what happened? The nasal bridge is flattened. Nasal bridge is also flattened. Okay, and the eyeball, two eyeball will be separated, little bit more gap between them. We call it hypertelorism. Okay, we'll get enlarged tongue, macroglossia. So there will be protruded tongue. Okay, small ear, and hearing loss is possible. Hearing loss, small ear and hearing loss. We got that. You go to the eye now. Eye will get, in the eye it will be obliquely located. There will be gap between two eye and it is obliquely located. Okay, so oblique palpebral fissure, oblique or slanting palpebral fissure. Okay, we have oblique palpebral fissure. We get also problem in the refractive error, like myopia. Refractive error in the eye. Okay, pigment in the iris. There may be cataract formation. Cataract, that is the opacity of the lens, that is possible. There may be hyperemia of the optic disc. There will be ectropion. The eyelid may be protruded outside. There may be blepharoconjunctivitis. Okay, so many problems in the eye, and there may be squint. Two eye may not be aligned together. One eye may be a bit deviated. So a lot of other problems like that of hyperemia of the optic disc, hyperemia of the optic disc or the optic disc. Okay, and there may be strabismus. So eyeball are not in alignment. We may get a lot of problem there. Okay, now we go to the clinical features or findings in the heart. Okay, here is the heart. Heart is here. Okay, so what are the problem in the heart? Then you get atrial septal defect, ventricular septal defects. We'll get phenostratology. Okay, then we may get mitral valve prolapse. Okay, so also we may get incompetence of the mitral valve or the tricuspid valve and patent ductus arteriosus. Okay, so we may have multiple heart anomalies. Multiple heart anomalies is possible. Okay, so in the neck region, again, if you go to we may get autoimmune thyroid disease. Autoimmune thyroid disease, maybe hypothyroidism, thyroid disease. Okay, and there is increased chance to get, okay, increased possibility of head and neck infection, like that of head and neck infection, like because of large adenoid, large nasopharyngeal tonsil, small hypoglottic space, small nasopharynx. So increased possibility of head and neck infection, head and neck infection, that is a possibility. Okay, and lung infection. Okay, there may be more chance to get pneumonia. Lung infection is possible there. Okay, you got that. These are the problem in the thyroid and also in the lung. Then what are other clinical findings? Clinical finding, if we go to the intestine, okay, in the GI tract, there may be esophageal atresia, okay. We might have duodenal atresia, and we may get in ultrasonography double bubble sign. Okay, on ultrasonography, double bubble sign. Okay, we got that. So we may have other part of the intestine maybe there may be atresia there, and there may be possibility of more chance to get congenital megacolon. This is also called Hirschsprung disease, and imperforate anus. Okay, we got that. We got the findings in the clinical feature. We may get this finding. Okay, then we'll go to the hand and toes. The fingers are shorter. Okay, and the pinky or the fifth finger will be curved and moving towards the thumb like this. This we call it clinodactyly. Okay, that is the flexion of the fifth finger, little finger towards the thumb. Okay, that is called clinodactyly. That is possible, and we get the simian crease. Okay, this is the epidermal rays. Usually we have more than one epidermal rays, but around 50% case of Down syndrome we get only one epidermal rays. That is called simian crease. Okay, if you go to the foot, we get there is much larger gap between the first toe and the second toe. Okay, so more gap between the first and second toe Okay, we got this problem. Okay, now if we go to the bone marrow, we may have other problem like that of increase incidence of leukemia in childhood. Okay, we got that. That is very common in a patient of Down syndrome. Okay, we got the as a whole, this person of Down syndrome usually shorter, so short stature, and longevity is variable. If there is not much heart problem, if it is managed properly, this person can survive up to 40 to 60 years survival. That is possible depending on the anomaly present in that person and support system. So survival maybe 40 to 60 years. Okay. Now, how can you diagnose the Down syndrome? Down syndrome diagnosis. Okay. We have many ways of diagnosis. Biochemical analysis, especially biochemical test. Usually we should go through to assess the alpha fetoprotein. Okay. Then the unconjugated estradiol, unconjugated estradiol. Okay. So this will be decreased and this will be decreased. But what will increase is because during pregnancy HCG will be high, and also one more we may do, inhibin A will be high, inhibin A, that will be high. So these two are low and these two may be high, usually high in case of biochemical diagnostic study to diagnose Down syndrome. So it is routine. After the age of 35, all women should go through this test. Okay, we have other invasive diagnostic tests like that chorionic villus biopsy. Okay, that can be done around the 12th week of pregnancy, chorionic villus biopsy, or we can do amniocentesis, usually done around the 16th week of pregnancy. Okay, so it can even be done after birth of the baby. We can take the cell from the baby and we can study the karyotype of the baby. That is possible. Okay, so management is depending on the anomaly, how to manage. The surgeon should manage that. Okay, and there should be some supportive therapy. There may be physical therapy because this patient has low tension in the muscle, hypotonia, and they need certain support and skill to survive. So they also need physical therapy plus occupational therapy, and certainly medical therapy. There may be requirement of surgery, especially if there any anomaly in the heart or in the intestine. Okay, so that's all about the Down syndrome. If you like my video, please support my channel, please subscribe me, share the information with your friends, and have a nice day. Bye now.